proceed. So the flow of presentation goes like this. In the first session, we will have introduction to health and mental health. Second is on mental illness. What is mental illness and what are the types, treatment and rehabilitation of mentally ill, and myths and hurdles to access treatment. Session 2, we will talk about again vulnerabilities. Then we talk about mental health and stress, coping strategies, and how to nurture mental health in our own personal and professional lives. So with this, let me begin the presentation. Let us start with an activity. I want at least 5 of you to give definition of health in a word or a sentence. Who will start?
Madam, this is HR.
What do you understand by health?
Can I, ma'am?
Yes,
Madam,
please.
sure.
Health is a position of mental and physical fitness.
Okay. Health is a position of mental and physical fitness. Thank you, sir. Thanks for the definition.
Okay, ma'am.
And next?
Ma'am, I'm from Bangalore.
Yes, sir.
I think it's an absence of disease.
Fine. Absence of disease is health. Okay. That's a good definition. Thank you. Others?
Ma'am, health is a state of complete physical and mental and social being well.
Who gave that definition, madam? Please tell that also.
Myself, Dr. Basavarajeswari, ma'am.
Okay, the original definition which you quoted, who gave that? Yourself?
Dr. Basavarajeswari, ma'am.
Okay, right. Okay, thank you.
Thank you, ma'am.
It's a state of physical and mental wellness. That's what you said, right?
Yes, ma'am.
Okay, thank you, madam. Next, please.
Thank you, ma'am.
We got from 3 people. Quick. Should I call names or will you share voluntarily?
Ma'am, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or impairment.
Sir, if you had given this on your own without reading, it would have been nice. But anyway, you have quoted from which place? That is what I asked. The definition is given by whom? That's a right definition. That's why I'm asking. You have muted yourself, sir, so I can't hear. Please unmute the mic. Yes.
Madam,
Okay. Next person, please.
World Health Organization, madam.
Yes, sir. It's a definition by WHO. Thank you. One more definition, please.
Madam, it is a condition of human body.
It's a health is a condition of human body. And
yes.
Okay, all right. Thank you for giving these definitions. Now I want other 5 people to define this. What is that? What have I shown?
Mental health, ma'am.
Exactly. So how do you define mental health?
Free from stress, ma'am, and peaceful from mind. That's it.
Okay. Peaceful in mind and away from
Free
stress.
from all the stress.
Yes, good. Next.
Madam, proper functioning of the mind.
Sorry, repeat, sir.
Madam,
I can't hear, madam. Please
mental health is
Huh.
proper functioning of the mind.
Proper functioning of the mind. Okay. Mental health is proper functioning of the mind. It is away from stress and it is being peaceful. Okay. 3 things have come up. Okay. Next person, please. Thank you, sir. Next person, please.
And stability of emotion.
Stability of
Emotion.
emotions. Okay. Stability of emotion. Okay. Thank you, madam. Then any others?
Sound body in a sound mind.
Sound body in a sound mind. Yes. Okay, sir. Thank you. But what is soundness is another question that will come with that. Anyway, let us not dispute what is being put forward. One more person, please.
It is a state of mind without any worries and stress.
Okay, a state of mind without stress or worries. Thank you, madam. So we have attempted to define health and mental health. So let us, before we begin the further elaboration, let us see what the standard definitions are about these health and mental health. Okay. As mentioned by one of the sirs, health is defined as a state of complete physical, mental, and social well-being. Merely an absence of or infirmity is not considered as health. Okay. Absence of disease or infirmity is one way of defining health, but only having no illness or no infirmity does not mean an individual is healthy. It is a state of complete physical, mental, and social well-being. That is what the WHO definition said in 1948. But we have to also see here that when we say it as, a state or a condition, then we are sort of limiting it and also saying it as, it is a stable situation. But as we all know, health is not a stable situation. It can vary from time to time. So we cannot say it's a state. It is a variable. Health is not a constant which can stay forever. Like I cannot claim that I will be healthy all through this session only. Who knows what can happen? So when that is the situation, we can't say it as a state. That is a dispute with regard to this definition. But whatever it is, the ultimate aim of saying that somebody is healthy or considering someone as healthy is that at this point in time, the person looks physically fit, mentally stable, and socially well adjusted. These are the 3 things which we consider when we talk about health. Now, when we talk about mental health, the definition says that it's a state of well-being in which the individual realizes his or her own abilities. They can cope with normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. So they are talking about, when the WHO gave this definition, again, they said it as a state of well-being, in where the individual is able to realize his or her own abilities, potentialities, and there are stresses, but the individual is able to cope with the stressors, and they can productively work, and it can lead to fruitful results, and they are able to make a contribution to his or her community. So, mental health is a term used to describe a level of cognition or emotional well-being and not just an absence of mental disorder. This is what is the standard definition of mental health is according to the WHO, which we have accepted. So when we finally talk about mental health, we are looking at an individual who is well adjusted within himself and with his environment. The person is capable of making contribution to the community too. So these are the parameters on which we judge health. But when we are talking about health, like one of the sirs said about definition of health, he said absence of disease is health. Okay. So when we are talking about that, we have to also look at what is mental health, or how we have explained it, or the psychologists have explained it, and why we say this in contrast to ill health. So we will explore this further. So mental health means it includes physical is obvious, along with that emotional, psychological and social well-being. And that is emotions. One of the madams gave the definition about it is, being emotionally stable, handling our own emotions. Okay. And the second factor is when we are talking about thinking. Okay. The person, how the person thinks, feels and acts as they cope with life. So, three important psychological processes are given here. One is their cognition, or ability to think, receive information, process information, and accordingly take up an action. While doing that, what is the content of their emotion to that particular thought and emotion, and then behavior, that is called acting. Acting means what? To act upon what they have thought about. It helps to determine how one handles stress, relates to others, and makes choices. This is also part of being mentally healthy. How one person handles the stress. They are able to relate with other people in the vicinity and making choices, informed choices in a fair way to lead to a personal as well as professional satisfaction. Mental health is important at every stage of life, from childhood to adolescence through adulthood and old age. So we cannot say, some of them, when we talk about myths related to mental illness, we will also talk about a myth called, children don't have psychological problems. Children are mentally healthy. Children don't have mental health issues. So these are all, wrong notions that we have. So at every point in life, there are issues related to mental health according to the age-related challenges. Children have their own challenges. Adolescents have their own challenges. Youth have their own challenges. Similarly, through adulthood and old age, like every day, we all face challenges. The same thing leads to mental health as well as mental illness related issues. And mental health is a right for everyone, irrespective of age, gender, race, religion, class, or nationality. So everyone requires mental health. We cannot say so and so does not require mental health services. So and so can be excluded because of their gender or age or race or religion or class or nationality. Because when we discuss about mental illness, we will know that across all these parameters, mental illness can happen to anyone. So when illness can happen, then health has to be addressed. So that way, if we look at it, mental health is part and parcel of every human being, which has to be given its due importance. And good mental health is more than a mere absence of the disease. Okay. Just like we have talked about health, in mental health also, we need to know that absence of illness does not mean health is a continuum from illness and disease to death at one spectrum, one end of the spectrum, to the other end of the spectrum, which is total well-being, well-adjusted well-being, to positivity, to not having disease, to further discomfort and all that. So the continuum goes. So in that continuum, we should always be looking more at wellness rather than illness. So let us now talk about mental illness. Does anybody have a doubt till now? Would anybody like to ask any question, or shall I proceed? Are we clear till now?
Clear, ma'am.
Okay, thank you. So when we talk about mental illness, what is mental illness? It refers to a wide range of disorders that affect emotion, that is mood, thinking, that is our cognition, and behavior, that is how we act. Because generally, if we say, how do we recognize that somebody is mentally ill? The first thing that comes forth is abnormal behavior, right? He is acting strange. She is acting strange. They are acting in a manner which is not seen on day-to-day basis by normal people. So the first fact which comes through is abnormal behavior, followed by display of abnormal emotions. Maybe it is anger, maybe it is sadness, maybe it is extreme happiness, maybe it is being garrulous, that is speaking too much. There may be few things. And then probably when they are talking, we start realizing that there is some abnormality in the way they are thinking. So these are the prominent features of mental illness. It can affect, like I mentioned earlier, it can affect anyone regardless of age, gender, social standing, religion, race, or ethnicity. And people with mental illness often experience distress and problems functioning at home, at work, and in social situations. So they are disturbed and they experience personal distress also, and they show problems in the way they function at home, at their workplaces, and also in social situations. I'm sorry about the spelling of situation. Mental illness is not something the person can overcome with willpower. So this is something that we need to very clearly understand, because it is commonly said, again, when we talk about myths, we come to know that people say, be strong. There is nothing like mental illness. There is nothing like mental weakness. If you are strong enough, you can handle everything. So these type of pep talks are not going to help when the person has real mental illness. So when we talk about the magnitude of the mental illness, we see that irrespective of age, gender, ethnicity, race, religion, nationality, we see that 1% of the population all over the world suffers from mental illnesses, major mental illnesses, not just mental illness, major mental illnesses. And an estimated 10 to 12% of population, apart from this major mental illness in 1% population, they suffer from minor mental illnesses such as anxiety, depression, alcohol and drug abuse, etc., etc., etc. And it is seen that about 15 to 20% of patients visiting general practitioners with complaints of physical illness actually do not have any physical illnesses, but they are suffering from psychological symptoms which show as physical illnesses. Mental illness is invisible. It is poorly recognized and an unreported group of illnesses. It is not just single illness. It's not a single entity, but it's a group of illnesses. We don't say we have a physical illness. Okay, in that we specify, okay, I have a lung infection. I have a cardiac problem. I have a neurological problem. I have an orthopedic problem. So likewise, when we talk about mental illness also, it's not one single unit. It's a group of disorders. And mental illness is not a communicable disease. Okay? It does not spread from one person to another. And it has a high burden on the sufferer, family, and community. Especially when we talk about major mental illnesses, we see that people with major mental illness, they suffer due to a high burden of stigma and segregation, number one. And secondly, the family suffers due to financial burden, emotional burden, and also social burden. Community suffers a lot because mostly youngsters from productive age group are affected by major mental illnesses. So that takes away their productive life and their ability to be socially contributing members to the community. So instead of being productive contributing members, they are affected by disability, causing a burden on the exchequer or the state also. So because of this, this group of diseases causes a high burden on everyone, the sufferer, the family, the community, and the nation. It leads to loss of productivity, quality of life, and chronic suffering. So let us briefly look at, because this is a very vast topic, I will only touch very briefly about types of mental disorders, treatment, and rehabilitation, so that you are just aware of it. Before I do that, how many of you here are from the subject psychology? I know you are all appointed for the first grade college, but how many of you are from psychology background or have done masters or doctorate in psychology here? Nobody? Okay. Have any of you come across people with mental illness in near vicinity? You have heard, you have seen, or you have first-hand information about having someone in the family whom you have seen with mental illness? Anyone?
Hello, ma'am.
Sorry?
Ma'am, as a teacher, has
Ah.
seen in my college so many people, especially students, are having a mental illness due to their family issues. Like
Okay.
a dad and mom is separated, or if they are in together also, every day they fight. So we refer them for the
Okay.
counselor.
Okay.
And based on the counselor suggestion, they might go for 1 month of training program just to recover.
Okay.
Some have a peer pressure, a relationship breakup, and there are many reasons in case of financially or many other personal reason. Some reasons are disclosed with the teacher, some without the disclosure with the teachers, they go directly go for the counselor.
Okay.
So we see every day with the one new students.
That's nice, sir. Mr. Shakin Raj, right?
Yes, yes, ma'am.
Yeah, thanks for contributing, because these are the issues that we need to take up when we are talking about intervention at, in the second session, the issues which affect the students basically, because they can be a precursor for getting something becoming worse, or they can be a precursor for building the personality for future. Both can happen depending on the support they receive. So as teachers, we need to be aware of how best we can help the students. So for that reason only, I have been focusing a little on this. Though, it is not really very much important to know in detail. At least you should know that these things are there when we are talking about mental illness, and how we should recognize it. And when the time comes, if it is necessary, to refer them to right kind of help. Okay.
Yes.
So with this, let me start. So major types of mental illnesses, we can just say there are different types of classification. Two major types are International Classification of Diseases, and another is diagnosed, followed by WHO and European countries as well as India. And the next one is called DSM, Diagnostic and Statistical Manual, and that is followed in the American subcontinent. These two, they have quite a lot of similarities. And in that, one type, the first type that I would like to discuss here is, bring to your notice is major mental illnesses. In this, basically what we call as psychotic behavior due to two illnesses. One is called schizophrenia, another is called bipolar affective disorder. These two are called major mental illnesses. In these two mental illnesses, usually the symptoms of illness are very much visible. They are chronic and they require long-term treatment. Okay, these three are the hallmarks. One is behavioral change, mood change, and abnormal thinking. These three are clearly visible in a major mental illness. They require treatment, obviously, and with the treatment, they can get cured or they might remain with some amount of symptoms leading to chronicity. Okay, two illnesses are schizophrenia and bipolar affective disorder. Schizophrenia basically is related to thought process. So what happens is person starts believing in some delusion. Delusion is a false belief which is fixed in his or her head. For example, I may suddenly start thinking that I am Mr. Donald Trump and I am all powerful. The whole world listens to me. And because I am so powerful that everybody wants to kill me. So I become suspicious of all of you, thinking that you are all plotting to kill me while listening to me. So what will I do? I will show my suspicious behavior. I will just try to see what you are talking amongst yourself. And I will start looking at which one of you is my enemy number 1, enemy number 2, enemy number 3. And in this type of faulty thinking, I might try to attack you also. And generally, when we have major mental illness, commonly biological signs, what we call as eating habit, sleeping habit, and bowel movements and sexual activities, all these biological functions get affected. So if I am very suspicious about everything, everybody, I may think that my food is poisoned, so I don't want to eat. Even if I am hungry, I will not eat. Or I may not drink water because I think the water may be poisoned. So I start suspecting everyone, everything around me, and I show that suspicious behavior. And when questioned, I can become angry and aggressive. So these are some of the features through which we can identify a marked behavioral change. And if we question the person about his thinking or his feeling, then we might realize that something is grossly away from normal. So these type of illnesses or the major mental illnesses, they require immediate psychiatric consultation, probably admission for a short duration, and medication. The first line of treatment is to take medicines. So in case you come across such abnormal behavior, immediate thing will be to, if you have a psychology department in your college, better to check with them to sound the person who is behaving abnormally and find out if he requires help and refer them to appropriate psychological health providing agency. Even if it is not there, maybe a counselor or a general doctor also to check whether the person requires referral to a psychiatric care. That should be done. The second group of illnesses are called minor mental illnesses. And these type of mental illnesses are a group of disorders. Predominantly anxiety, neurotic depression, and phobia, obsessive compulsive disorder, post-traumatic disorders. So these are some of the disorders which come under minor mental illnesses. We all have suffered from anxiety, but for some people, the anxiety is so much that they are incapacitated. For example, when they are faced with situations where they are asked to talk, they have a fear of stage. Then what they will do? They will not attend the class on that day at all. We all might have faced certain students who are so scared of facing an audience that they will rather bunk the class, or they will keep quiet and don't open their mouth at all, and they will go to any extent to avoid coming to the class on the day that they have to give a presentation. So these are the things which we observe among students. So this we call it as minor, not because their problem is small for them. For them, the problem is very big. But it is minor in comparison to a behavioral disorder and a thinking and mood disorder like schizophrenia or bipolar affective disorder. So in comparison to that, we say this as a minor mental illness. Okay. And similarly, excessive fear of certain things, like we all know, agoraphobia or social phobia. Then we have fear of spiders, we have fear of snakes, we have fear of fire, we have fear of closed spaces, we have fear of water, we have fear of heights. Every person can get a fear about cockroaches, insects, so many things. You can have a specific phobia or extreme fear, which makes the person to totally stop functioning when they come across such fear-invoking stimuli or instances. And for panic attack is also a type of extreme anxiety where a person feels totally incapable of functioning at all. So these are all called minor mental disorder. Obsessive compulsive disorder is also a type of disorder where a person gets repeated thoughts about not being hygienic, not being clean, or fear of germs, and hence keeps on doing certain compulsive behaviors, which are to an extent that the individual is not able to attend to regular activities because of the compulsions. Now, just to give an example, when we are going out of the house, if we have to lock the door, I'm sure we will do double checking and triple checking. But let us say, for example, a person, if they have to go out tomorrow for 9 o'clock class, from 7:30 onwards, they start bolting all the doors, all the windows, and then go one round checking whether they have locked it, and then go around the house to check whether the windows are shut properly from outside, then come back into the house, then again check, and then finally lock the door after checking whether they have closed the gas cylinder or closed the switches off, fan switch, TV switch, geyser switch, everything is off. And then they lock and go out, and then they check it 3 times because it's a ritual. And then they go. While they are doing the checking for the 3rd time, let us say somebody comes and asks them for direction. So they forget whether it was the 3rd time checking or 1st time checking. So again, they start doing it from the start, from the beginning. If they start doing that, instead of, even if they start at 7:15, their checking will not get over at 9 o'clock also. Whereas they were supposed to attend the class at 9 o'clock. So what happens? They miss the 9 o'clock class and they may go to college at 10 o'clock. This is the type of compulsion I'm talking about when we are talking about a disease called obsessive compulsive disorder. Okay, so these type of illnesses, they are considered as a minor group of mental illnesses because when you look at them immediately, you may not notice any major change in thinking, feeling, or behavior of the individual as compared to when we see it obviously in the major mental illnesses. But the individual undergoing these symptoms will have a lot of anxiety, will have a lot of suffering, and they understand that what they are doing is not normal. They are doing it too much, and so they know that they require help, and for that they may seek help or they may not seek help also. Either ways, they suffer. And the main treatment mode here is not just medication, because medicine by itself cannot help in these type of minor mental illness. It requires behavior therapy, cognitive behavior therapy, a lot of psychological as well as behavioral interventions. And to reduce anxiety, maybe they are given some amount of mild medication, but not major medicines like antipsychotics in terms of major mental illness. The third group of illnesses, again very important from the point of view of your students, is substance abuse. That is addiction to alcohol, drugs, and tobacco. Commonly seen, and nowadays very commonly getting reported, is addiction to social media, use of mobile phones, and also modern technology, dependence on modern technology for everything. So this type of abuse can cause, and gaming, online gaming platforms. So these are all causing new addictions now. And these addictions form a very major chunk of youth, and they cause very high burden on the individual, family, and society. We all know how smoking is injurious to health, how alcohol addiction destroys families, and the drug addiction has had a major impact on the economy of very many countries and states. So I don't have to elaborate much on the impact of substance abuse, but realize that substance abuse or substance addiction is something that is not just, a behavioral problem. It also has psychological and social impact, and the reasons for dependency are also psychological. So alcohol addiction it is a mental illness also, because many people with alcohol addiction suffer from inferiority, they suffer from depression, and to camouflage depression, they go to alcohol. And leaving addiction is no joke. If you read the slogan of Alcoholics Anonymous, they say, "I am helpless in front of my addiction." And there is also a saying that once an addict, always an addict. So if you are a part of AA, they will say, I had my last drink that day, or that many years back. But they can never say that I am free of my addiction. They can only say I have been abstinent for such a long time, but you can never say we are free of our addictions. They are another major group of mental illnesses. And the next one is psychophysiological disorders. Under these come, like I said, 15 to 20% of patients attending to general practitioners, they suffer due to psychological reasons, not physical reasons. So one of the major features of a person repeatedly visiting the general practitioner for health checkup, it's called hypochondriasis. That means excessive fear that something is wrong with my body. So the doctor checking me is not checking me properly. So I need to keep on changing my physicians. So I go with a complaint that I'm not able to breathe properly. My lung is affected. So you please check the lung. The doctor checks everything and says your lungs are perfectly fine. Then he will not get satisfied. Then he will go and check all the medical terminologies and illnesses available, and he will come up with some rare syndromes, or he will go and say, I have a cardiac problem. That's why I'm having breathing difficulty. And then they will check for cardiac. Then they go to doctor for some stomach ailment. Whether required or not, they will take so many treatments and so many tests, and they keep on going and doing doctor hunting because they are always preoccupied about not having perfect physical health. Some of them have sleep disorders. Some of them have eating disorders. Eating disorders like anorexia nervosa, bulimia nervosa, usually seen among young girls. They have a very wrong notion of body image. If you look at, popular social media and also entertainment industry, tall, slim, fair, beautiful, this is the image of a heroine. So they want to be like that. So what they do, they start with slimming or dieting and take it to an extent that instead of, they lose 15 kilos, 20 kilos, 25 kilos, they become undernourished. They become nutritionally deficient. Still, they don't stop dieting. Or they go on binge eating and then dieting. So these type of eating disorders destroy the esophageal and stomach tissues. Still, they will not listen. Sometimes they have to be force fed with tubes running through their nose because they refuse to eat, thinking that they have to be thin. They have to be according to the model size, which they think is appropriate for them. So these type of eating disorders are a problem. Sometimes stress can cause, overeating, and that can cause obesity. That is another extreme. So that is also a under the rubric of psychophysiological disorders, if it is of psychological origin. Then sleep disorders, like for example, insomnia, very commonly seen among the youngsters in the working age group nowadays. Excessive work pressure and they don't sleep, or they do everything on the bed itself. Like for example, work from home. So where do you work? I work on while sitting on my bed. The same bed is used for sleeping. The same bed is used for eating also. So there is no dining area. There is no relaxing area. There is no workspace. Everything is on the bed itself. So and entertainment also. They will have a wall-mounted television. So they do watch the television also, or on the laptop only. They will be watching series also. They will be doing work also. They will be chatting with friends also. Overstimulation, causing people to lose sleep over a period of time. After a point in time, they will be desperate to sleep peacefully for 1 hour, 2 hours. They will not get sleep. Whether it is daytime or nighttime, they may get sleep, but it won't make them feel fresh after they get up or wake up. So they need to go to doctors consulting for induce medication to induce sleep. So that type of disorders can also come in. And sexual dysfunction disorders, they also can come under psychophysiological disorders. Then we have a group of disorders called personality disorders, where the individual personality is such that the individuals cause a threat not just to themselves but also to the society. Like for example, antisocial personality disorders. We also have histrionic personality, narcissistic types of personality disorders, though neurotic personality disorders. So these type of personality disorders cause considerable amount of distress, not just to the individual, but also to the family and to society. Then we have a whole group of disorders related to the children and adolescents. They are development related, and learning related disorders in children. And in adolescents, it can also be related to their sexuality issues. Then we have another group of disorders. They are coming under mental retardation. Now, as teachers, you need to understand one thing, that mental retardation and mental illness are two different things. They are not the same. Mental illness is different. Mental illness can come to persons at any age, whereas mental retardation is a developmental issue. It can either be caused by prenatal, perinatal, postnatal, or during the childhood due to head injury, fever, or something like that. And it's a developmental disorder. It has got nothing to do with mental illness. So it is like you have lost a limb during childhood. That limb is gone forever. Likewise, the intelligence, mental retardation is related to intelligence, person's intelligence. Retarded person's intelligence level is low, what we call as low IQ, low intelligence quotient. So when intelligent quotient is less, IQ is less, then you cannot lift it up by any artificial means. You can only facilitate in training the person with limited intelligence to achieve a level of independence if possible, depending on the level of intelligence. So IQ is different. Mental retardation is related to intelligence of the individual. It has got nothing to do with mental illness. So they are two different things. So when we have talked about mental illness, let us cover briefly about treatment. So when we talk about treatment for major mental illnesses, the main mode of treatment is pharmacotherapy. That means providing medicines. Okay. So giving them medication, appropriate medication at the right time can cure mental illness to a major extent. So there are medicines available to treat all these types of mental illness. But in some cases, only medicine is not enough. They require psychological counseling and psychotherapy support. Then, for any mental illness, what is required is education to the family and the patient. This is called as psychoeducation. We need to give this type of education to patient and family to be able to remove the misconceptions they have about mental illness and take proper treatment. Like I mentioned, psychotherapy and counseling are very important part of giving treatment in mental illness. It includes, along with psychoeducation, family therapy. Like the sir previously mentioned, many a times we see that children come with the symptoms because of divorce situations, separations, family fights, alcoholism in family. A variety of family problems are expressed through children falling ill. Children falling ill can also be an indication for some problem, undergoing or underlying problem in the family. So such families require family therapy to overcome the problematic situation. Then we also have occupational therapy, especially for chronic major mental illness patients, to help them to come out of post-recovery phase in major mental illness. In this regard, one more thing which is equally important is psychosocial rehabilitation. It is not enough if we diagnose, if we treat. We need to give rehabilitation also, especially for patients who have chronic mental illness. Like for example, we know that what do we mean by chronic? Any illness which has run for more than 2 years of time, with continued symptoms and continued suffering for the patient and the family. That is when we say we have the person has got chronic mental illness. So whenever there is a chronic mental illness, there is also disability. If you look at Persons with Disabilities Act, you see that mental illness is also considered as a causing disability, and they are part of rehabilitation package which is offered for other types of disability. So mental illness leads to disability. That disability is measured through a different instrument called disability assessment scale, through which we assess the disability of the individual, and a certificate is given by the district surgeon and and that can be given to disabled welfare department, and through them they can get the benefits for disability, like disability pension or travel concessions, and some help for their caregivers. If we look at in Karnataka, our chief minister recently launched on the World Disability Day, some honorarium for the caregiver of the disabled, which is very, very important to recognize that caregivers require some amount of support. It may be nominal, still that recognition is very, very important. So people with chronic mental illness suffer due to disability in social functioning, in occupational functioning, and they require help in their personal hygiene maintenance also. So for such people, disability benefits have to be provided. And other than this, we also have what we call as organic psychotic syndromes. Epilepsy comes under such disease. Dementia is also one such disorder where psychological as well as neurological intervention is required. So, are we clear on these things so far? Or do you have any doubts?
Ma'am, I have a question, ma'am.
Yes, please.
My name is Sangeeta.
Yeah.
So I had a question regarding the treatments that you have mentioned that could cure the minor mental illnesses. Does yoga and meditation also help in curing these at least minor mental illnesses, ma'am, like
To
anxiety?
some extent,
phobia?
relaxation techniques are used, madam. The mode of relaxation technique depends on the type of the illness and the counselor's orientation. Both are important here. And what I would strongly suggest against is that just not to go by what is showed online as cure for all.
Yes, so usually, online what we see is like for mental health, good mental health, yoga, meditation, and everything. So that is
Yes.
one doubt that I had.
Good mental health, you go for yoga, relaxation, okay. But as a treatment for mental illness, you don't take these steps by default.
Okay.
That
So
is
as a
what I want to
prevention,
say.
I think we can go for prevention from,
Yes,
yes.
prevention, yes.
Yes.
Positive health development, you adopt yoga, meditation, relaxation, vipassana. There are so many, Eastern as well as Western methods
Yeah, both,
available for that. That
Yes.
you can go as part of preventive and protective,
Yes.
positive mental health work. But for treatment, you need to have a specific consultation from the counselor or the psychiatrist or the psychologist or a mental health professional, and only based on their advice. Because when we talk about schizophrenia, meditation is not advised.
Yes.
It is not to be done because they have a problem in thinking. They have a problem with concentration and attention. So if you force them to, focus on one thing, it is going to cause a lot of disruption to them. So we need to be extremely cautious when we are talking about treatment.
Yes. Thank you so much, ma'am. Thank you.
Okay. Anyone else? Any other question before I go to the next slide?
Ma'am, these type of disorders are inheritable.
ಏನಂದ್ರಿ ಇನ್ನೊಂದ್ಸರಿ ಹೇಳಿ ಮೇಡಮ್ ರಾಜೇಶ್ವರಿ ಮೇಡಮ್.
This type of disorders, ma'am, those are inheritable or not?
No, there are various causes for it, madam. Some of them are inherited. Some of them are imitated. For example, schizophrenia and bipolar affective disorder, there is a 33% chance of getting inherited by parents if both the parents are having the similar illness. Okay. Whereas when we talk about phobias, fear of cockroaches, it may be imitation also. Mother screams looking at cockroach. The child also learns to scream. Not because it is genetically inherited. It is because it is imitated. So both are possible. Hereditary also is there in some diseases, and non-hereditary observed and imitated behavior is also there in some.
Okay.
Yeah.
Thank you.
Welcome. Okay. So now, before we go to our next session, I have this because this is very important as teachers for you to follow. So there are certain myths and misconceptions to get treatment when somebody is suffering from mental illness. So I want some of you to enlist common myths about mental illness. Myth means what? It's not a fact. Okay.
Misconception.
Misconception. Misconception. Okay. So it is something which has originated simply without reason or logic. It's neither confirmed by scientific interrogation. Still, people believe it and people follow it. So that actually is a major hurdle to access treatment in mental illness. So I want us to know this, because when we address, if we ask, I don't know, my common experience is that when we have identified issues related to mental illness in students or in people around us, when we ask them to seek treatment, the major block is because of this myth and the misconceptions. They refuse treatment. 3 things are hurdles in accessing treatment when we have mental illness. First one is this, myth and misconceptions. Second one is lack of manpower, resource, and accessibility, affordability, and accessibility. These 3 are the major hurdles. The number of mental health care professionals are very, very, very limited. All over the world, and especially in India, it is so limited that even if you want to, you don't get psychiatrists, you don't get psychologists, you don't get psychiatric social workers, you don't get psychiatric nurses. So without them, it is very difficult to handle the caseload. Okay. So access to treatment and affordability and also accessibility, these things becomes a major problem. Okay, so let us look at some of the myths that you have come across. Quickly.
Ma'am, I would like to list.
Yes, please.
In my college, I have seen a student with a mental health condition. So when I speak to the parents, they usually tell that, no, ma'am, it is a low intelligence problem. He doesn't have a mental health condition. They believe that if a person has a mental health condition, it means the person has a low intelligence. So
they confuse mental retardation with mental illness.
And most of the times I see this. Okay. And there is also one more thing that they are not ready to accept that they have a mental health issues. Like they usually say that it's not a big issue for the teenagers. It's quite common. It's a mood swings. It could be a hormonal fluctuation. Might be he's doing it because he's in the seek of attention. I don't know, but I get people telling this. Nothing, ma'am. There is nothing much. He needs attention, so he's just acting like that. Yeah, these are the few things. I think it's also a myth. People don't want to tell that they are weak, so probably they're coming up with the reasons to hide the real cause for the mental health condition. This is what I have come across.
Exactly. So the person with mental illness means the personality is weak. He is not strong enough. So that is one of the myths. That is not true. Okay. Anybody can get affected. The best example is one who was affected and yet came out boldly is Deepika Padukone. She was at the peak of her success and she suffered depression. And she underwent treatment. And afterwards, she came out of it and she has launched an NGO to talk about how she went through depression. And please remember, she is a self-made success in the movie world in India.
Bollywood.
Okay, she had no big backup family for her. She, in fact, went against her parents. She walked out of the house and she established herself as an actor of excellence and became a top actress. And at the height of her career success as a film actor, she suffered from depression. Was she weak? No, she wasn't. She was a very strong lady. But yet she was vulnerable. So all of us can be vulnerable. Why I am talking about myths is to tell the parents or the caregivers or the sufferers themselves that look, just because you are having a setback does not mean that you are weak or you are not strong enough or that you cannot recover. It is not like that. So that is one myth. And that it is retardation is another. And the third one is it is just attention seeking, trying to trivialize the symptoms so that they deny that the person might be having mental illness. That is another myth which is there, which causes a hurdle to access the treatment. Yes, thank you. So others, please.
Ma'am, commonly
any such myths?
Yes, ma'am. Commonly people think this is because of sin. So they will take the person to temple and make so many pujas something. But they are not ready to accept that that is mental illness.
Very true, madam. Very true. In our culture, not just in our culture, all across the world. One is that they consider it as a sin. Okay. Second is they consider it as black magic, especially in India. If you look at it, the way region, you will know about Datta Mandirs. They are specifically taken to Datta Mandirs for treatment to get the bad spirit out of the body. So many people go to faith healers and try to take away the black magic rather than take them for treatment. That is there, madam. Very, very good point. Thank you.
Thank you.
Next. Anybody else? Come on, there are so many myths about mental illness. I'm sure you know it, but you are hesitating to speak about it. Or are you being very sleepy?
No, ma'am.
Hello, others?
Ma'am, most of them, whenever the students or somebody talks about mental illness to their parents or mentors, usually parents say that it's okay to have like that because in our age general we did not have anxiety, depression. These are the words of new age or from Instagram and you're taking from that. We did not have it at our age. So most of the students feel cornered there, maybe because of that. No support from the parents because they don't accept these words that didn't even exist at their time.
Yes, because of that myth that only mentally weak get this. That is the reason behind this type of non-supportive home environment. One is parents could be in denial. They will say like, no one in our family, forget family, in our Vamsha, nobody has this type of illness. So it is just not possible. So you forget about it. Even when children come up with problem, We just ask for psychological assessment. We don't even say, to check the intelligence level or attention and concentration or, developmental delay is there, autism is there, any of this. We just ask them to check it out. Also, they don't want to even take for a psychological testing because they feel that they will get stigmatized. Okay, big fear of stigma. Stigma or the fear of getting a label of mentally ill. Okay, so that is there. Yes, madam. Thank you.
Excuse me, madam.
Yes.
Madam, what is your best advice to keep our mental health well, madam?
I will talk about it in the next session.
Oh, thank you. Thank you.
We still have one more session to go.
Okay, madam. Thank you.
So, myths. Okay, we have another 3-4 minutes, I think, 5 minutes. So, I will only quickly highlight that. See, one of the commonest myths which causes a problem in terms of major mental illness is that frustration due to non-fulfillment of sexual satisfaction is considered as a reason for mental illness. So, they think that marriage is a solution to get out of mental illness. So, in major mental illnesses, sometimes people, the moment they come to know that the person has a mental illness or showing abnormal behavior, they want to quickly marry off the person, either the girl or the boy. And this causes major problems to the person who is getting married as well as the person who gets married. And usually such marriages end up with separation, divorce, and acrimonious scenes between the parents of girls and the boys, between whom the marriage has taken place. Okay. So again, a misconception, major misconception that marriage can cure the problem related to mental illness, which causes disruption to not just one family, but to all the families. Okay. The next misconception is again that mental illness can run in the families. Okay. So because of this misconception, people don't want to give daughters in marriage to that family where there is a mentally ill patient, and they don't want to bring daughters from that family into their families also. So not just, we have had, when I was in Nimhans for quite some time, I was working there also. We have seen families coming with the request, please keep my son in the closed ward for 3 months. We are searching for an alliance for my daughter. If the family comes to know, the boy's side comes to know that we have the girl has a mentally ill brother, she will not get married. So please keep him in your hospital for 3 months. We will get her married and then take him back. And this type of stigma and isolation is faced by families also. So marriage related issues are some of the things. And another myth, like I said, children cannot get mental illness, or in our family there is no mental illness. And then sometimes there is a myth like mental illness is related to the cycle of the moon. So the person gets illness attack during new moon day or full moon day. Again, they go for black magic on new moon days, and they go to puja on full moon days. This also they do. And they go to any god or goddess supposed to help in getting this bad spirits out of the body, be it a dargah, be it a church, be it a temple, anywhere, everywhere they will go, but they will not go to the mental hospital because of the stigma, right? So these are some of the myths which basically cause a lot of, and also there is a fear that mental illness is not fear. There is a belief, misconception that mental illness is incurable. Once you are mentally ill or once you go to a mental hospital, there is no coming back. There is no returning. So it is a point of no return. So once you are admitted to a mental hospital, that means your life is over. You will be confined to the closed ward only, in the mental hospital only, which is very, very, very wrong notion. There is treatment available for every type of mental illness, and majority of the people are able to recover. Even in major mental illness, about 30 to 33% have total cure. With 2 years of medication, they have no symptoms, only one episode, and they become totally all right. Whereas some may remain with residual disabilities, but about 30 to 35% of those who suffer from major mental illness, they may continue to suffer from the disability. So mental illness is curable, but the myth is that they will not get cured. And that causes a lot of hesitation to access treatment. So with this, I will stop the current session now, and we will continue again at